Welcome back to the DDT Method podcast. I'm your host, Drew Donaldson, and this week I'm sitting down to discuss training, nutrition, and coaching, as well as HRT with Jasen Kohli. Jasen brings a pretty unique perspective to the world of health, fitness, training, and bodybuilding. He's a competitive bodybuilder, incredibly accomplished in his own right. He's a very successful coach, and he's one of the owners of a very well-accredited HRT clinic based out of Las Vegas, Nevada. Jasen knows everything in terms of how to optimize performance as well as health, both from a level of nutrition and training and the level of optimizing hormones. He provides an incredibly unique and well-educated perspective, not only from his formal training and his business, being the owner of a clinic, but from practical experience, both with his own training and working with hundreds of clients over the years. This is the DDT Method podcast with Jasen Kohli. All right, guys, welcome to the DDT Method podcast. We have a very special episode for you this week. I'm here with Jasen Kohli, and he's offering a very unique perspective. He's a high-level competitive bodybuilder, a high-level bodybuilding coach, and he also owns an HRT clinic, Helix HRT. So he's providing the perspective of not only the athlete, not only the coach, but more the medical end and the longevity end as well. So this is something that you guys don't want to miss, because I know you guys always have a ton of medical-based questions, but you're also coming at it from an angle of a bodybuilder, of athletes, of just, regular gym bros. We're not necessarily all in the longevity community, meaning we don't just want to prolong our life. We do, but we also want to perform. We want to get bigger. We want to get stronger. We want to get leaner. We want to do all of these things. We want to have it all, do it all, be it all. And I think this is one of the best guys that we can talk to in terms of how do we achieve all that. So Jasen, can you give us a little bit of a background on yourself, both as an athlete and a coach, and then how did you wind up in the world of HRT?
Yeah. My background is mostly in bodybuilding, so I don't have any type of higher education or formal education beyond just high school. Most of this was all just self-taught through just experimentation and just being on the internet since I was a little kid. I got into bodybuilding at a young age, 16 years old. I did my first show. Kind of got hooked to it. I met a lot of great people along the way who just kept pushing me to continue competing. I competed as a teenager, then all through my early 20s. I even competed last year at USA's. So that's kind of my main background. I worked at gyms for a little bit, and then I eventually became a coach, which I did for a long time. I coached for 3 or 4 years. I had a pretty good roster of guys and girls, turned a few people pro. So I had your typical competitive bodybuilder coach background. And then I was approached by a friend with an opportunity to essentially, start a hormone clinic. And, I was always intrigued by it. Actually, the first guy that ever brought it up to me was Dominic Cardone, and there was a guy named I can't remember his name. He owns another clinic, but he wanted to franchise a clinic, so we were looking into that at one point. But I was always interested in it because I was you could prescribe this stuff. And then they were talking about you could prescribe Anavar, you could prescribe Nandrolone, you could prescribe all these different things, peptides, and I'm like, how do you guys do that? How do you do that legally? So I was always interested in that. So I eventually got given the opportunity to start a clinic. Started off really well. We built up pretty quickly. That first clinic was Magnus Medical, and then I parted ways with that business about a year ago, and then I started Helix. And so far everything's been good. It's interesting too, because my background with bodybuilding and going into the medical world, a lot of people are very, especially bodybuilders, are very weary of coming to hormone clinics because they're like, well, I'm blasting, I'm using all these drugs, are they going to approve me for it? My testosterone levels are already high. My health markers are off, whatever it is. Kind of the cool thing that I feel separates us is our medical providers are very well versed in the bodybuilding world. They know a lot of the illegal drugs, the non-prescription drugs. They're very familiar with what they do. They're very familiar with what health markers can be off. And they're okay with you coming to them and saying, hey, I'm on underground lab medications. call it medications, like products, testosterone, whatever it is. And I'd like to, be legitimate. I'd like to get it prescribed to me. And they're usually always okay with that. So I think that's what really separates us and kind of like bridges the gap between like the medical field and the bodybuilding world. Because for the longest time, I'm sure, as you know, doctors won't even touch you. You go in and you're like, yeah, I'm on all these drugs. They're like, stop. Like, what are you doing? they don't have any advice for you. They just tell you to stop. They don't understand harm reduction, which is one of our goals too,
Right. And that's one of the biggest things that you see, like, all across not only just competitive bodybuilding, but really in the fitness industry in general. A lot of us are doing some things that might not be, medically accurate regarding how we're supposed to do them. And then when problems arise, we're a little hesitant to go to our primary care or go to a wellness clinic or go to see a doctor, because in a lot of cases in traditional medicine, up until very recently and still in a lot of places, it's demonized to the point where a provider might not want to even touch you because you're choosing to do something, which is a little ridiculous, because if you have an alcohol problem or a recreational drug problem, there are legitimate professionals that will help you and will do their best to get you off of those drugs. Yet for some reason, when PEDs come into the equation, as you know, it just becomes this weird gray area and people don't quite know what to do. So it's always excellent to have providers, or a whole team, I should say, that is aware of what's going on. They're accepting the fact that you're going to do this, and they're going to help you mitigate that damage. And like you said, harm reduction is one of the most important things. Now, with that being the reputation of your clinic, are you seeing, I'm assuming you're seeing a pretty large number of just bodybuilders, gym rats, fitness enthusiasts that are coming in with.
Yeah, I mean, we get it all the time. I mean, it's funny because, I mean, we'll get people who are, just regular bodybuilders. They're just, lower level, just local level guys, girls who will come in, they'll get their blood work done. We'll find things where they're like, wow, I didn't know that was an issue. And then we'll get normal guys. I mean, we've had normal guys come in, just not bodybuilders. I mean, just regular gym rats. Actually, I have a good example. There was a guy last week who came in, got his blood work done, never done blood work at all, like has never done blood work as an adult. And his liver enzymes, his aminotransferase enzymes, ALT, AST are like in the 500s. And we're like, that doesn't make any sense. So we sent him to get a biopsy and an ultrasound on his liver, and it turns out he has a form of meningitis. So just things like that, we catch things like that. I wouldn't say all the time, but we catch things where we're like, wow, this could be a serious problem. Biggest things we see are like really high red blood cell counts, hematocrit hemoglobin, really elevated liver enzymes, kidney issues, blood urea nitrogen, creatinine being just way too high. And we're pretty familiar with like taking even extra steps there. A lot of doctors may just see the ALT, AST transferase enzymes just being like a little elevated. Maybe they're in the 60s or 70s, and then we'll get an even better test. We'll look at like the GGT, the gamma glutamyl transferase, which is a better indication of what their liver is actually looking like. Cystatin C for what their kidneys are looking like. So our providers are really good at like diagnosing possible issues. And even if there's things that are just slightly off, things that we can fix a little bit more. Hey, red blood cell counts a little bit high, drink a little bit more water before, make sure that that's getting there. Maybe throw in a little bit of nattokinase, whatever they recommend, But yeah, we see definitely some interesting things from patients coming in for sure.
You mentioned that just in the kind of case study that we just discussed really quickly, that it was an adult gentleman that came in, not a competitive bodybuilder, but had never really run blood work. Now, personally, I run my blood work every 6 to 8 weeks, but I'm a little neurotic. So I know that I'm kind of the far end of the spectrum. I'm also affiliated with several clinics, so it makes it a little bit easier for me to just go in and run those numbers. So I'm never going to tell anybody that they need to kind of do what I do in that regard. But I generally advise my clients and people that just ask me or inquire that blood work is probably most optimal to do at least quarterly, but that also depends on like what the situation is. Are you natural? Are you on HRT? Are you blasting and cruising? How often do you guys recommend to do blood work? But then on the flip side of that, for all these new patients you have coming in, maintaining let's say a case study basis of the guys that are using some stuff, your gym rats, your bodybuilders, as opposed to, or in opposition to, how often are you saying you guys should get your blood work done? How often are these guys actually getting their blood work done before they come see you?
It's kind of, I would say it's 50-50. We get guys and girls who come in that are very neurotic with their blood work. Because a lot of them are very well educated, especially nowadays. I mean, I think 10, 15 years ago, this wasn't a very big topic, talking about blood work and health markers and going to get a heart ultrasound and all these different things. Like, they just weren't, the tools really weren't like available. As the internet grew, everyone started to understand it more. And now that we understand lab markers better and the information's more clearly out there, people are more apt to get it done. But on the flip side, I would say there's definitely a lot of guys and girls who come to us who have been using performance-enhancing drugs for years. I mean, many, many years, who haven't gotten blood work in a long time. And surprisingly enough to me, too, a lot of those people don't have any issues. I mean, I look at their blood work and I'm like, I mean, for what you have been taking and what you've taken, doesn't seem like there's much damage there, at least in the blood work that we're seeing. So, sometimes we see things that are off. Sometimes we see people that they just have the genetics of a horse and they don't really seem to have any problems. But to be for how we work and how we recommend patients do blood work, we require blood work every 6 months. So we will not refill. If you have a prescription with us, with one of our providers that they've prescribed you, we will not refill that prescription if you haven't had blood work in at least 6 months. But we recommend every 3. I think every quarter is the best course of action, just because if there's anything that's off, we can really create a better course of corrective action if we can see it, happening, in real time, rather than just, every 6 months, we're just getting a small blood panel and just going, oh, that's off again. Oh, that's off again. It's better that we look at it and go, okay, this is a little bit off. Let's start to look at what we can do to make sure that that's not off on your next blood panel. And especially when they're first starting too, that's when we're going to see how their body's response is to the dosage that they're taking, the medications they're taking, whatever they're doing. And then we can make adjustments. Like, a big one that a lot of clinics have differing opinions on, and coaches, is what level of estradiol do men need. We have the clinics that prescribe a shitload of AIs, Arimidex, Aromacin, things like that, and just bomb people's estrogen into zero. Our philosophy on it, I think, is pretty along the norm with the people who are well educated. Well, at least our medical providers' philosophies is that we don't use AIs unless absolutely necessary. We'd rather change the frequency of the testosterone. If they're using too much testosterone and they're not trying to get huge, maybe lower the dose down a tad. Things like that. We really use them only as a last resort. So I think that's starting to become the norm because, I'm sure, as AIs aren't the best to take, for long periods of time. So, things like that.
How dangerous is it to abuse AIs or any anti-estrogen?
I think it's more dangerous than abusing testosterone, in my opinion. I think abusing AIs, that's when you can run into heart problems down the road. You can tank your HDL, bump up your LDL. I just don't think there's really a benefit, and especially too, if you don't need them. I think AIs have their place. If you've got someone who when their estradiol is just always constantly like running up high, it's going up 70, 80, 90 picograms. It's like, okay, it's better that we use a lower dose of AI to bring that down into a better range than just let that run wild. I think, and again, me personally, there's a range at which it makes sense, but then there's also a range where it goes, this is going to cause problems. It's going to cause insulin insensitivity. It's going to cause heart problems. I just don't think estrogen should be running that high, if that makes sense.
It's some estrogen to grow, am I right?
100%, because it keeps the androgen receptor sensitive too. It's protective to your organs. So, for me personally, if I'm anywhere from like 30 to 50, I'm good. I don't, there's no reason for me to be any lower than that. And it's a lot of the time the ratio between what your levels of testosterone are and the estradiol number is very important too. But I also think if it runs too wild, it's not benefiting you in any way. It's starting to get to a point where now you can have diminishing returns and damage to your body.
Right. And that range, like you were talking about, is so important, but it also is what makes things kind of confusing because that's kind of a wide range. I was looking at a new client's blood work earlier this week, and on HRT with a little bit of Arimidex, their estrogen was floating around 12, which for an off-season setting, or really any setting outside of just a couple weeks out, in my opinion, no way it should be that low. But beyond that, we do have that wide range. You were saying that you feel at your best between like 30 and 50. I actually feel at my best between about 55 and 65, and that's on a HRT dose with my testosterone floating around maybe 1,000 to 1,200. Now, since that range is so wide, are you going more by specific numbers? Like, is there a particular like facet of that range that you like to stay in, or are you going more by symptoms when you're within that range? And what symptoms are you looking out for? How do I know I'm too high or too low?
Yeah, typically the patients were going by their symptoms. Because you're right, everyone's different. I think there is again, just kind of preferencing, there is an outrageous range where maybe a patient still feels good, but it's like, hey, I think this is going to cause problems over time if you keep your estradiol ranges here for years and years and years. As you know, a lot of the problems that come with PED use are chronic. They're not going to be acute issues. But usually we see, the most common one is the gynecomastia. If you have patients who are starting to get, irritated nipple sensitivity, things like that, it's a pretty common indication for most people. Then from there, it just goes down the list. Some guy, and mostly speaking, we're speaking guys here, anxiety, mood swings up and down, excessive edema, things like that. Those are, I would say, more secondary symptoms. But usually most guys, when they get into that threshold of their estradiol being too high for what their body is comfortable with, is they're going to start getting gynecomastia.
Now, I know staying lean is one way to kind of downregulate that conversion to estrogen because you're actually lowering the amount of aromatase enzyme you have available in your body. Now, other than that, and other than manipulating the doses of these AIs, are there any other ways that we can kind of keep our estrogen in check or keep an eye on that?
There is DIM. I'm not so convinced that it's the best form of controlling estradiol. I think the best way of doing it is like you said, controlling your body fat. You really shouldn't be over. For a guy, if you're starting to get over like 18%, you're just getting fat for no reason. I think most guys can stay in a pretty healthy body fat range from like 12 to 15, without having to like kill themselves nutritionally to stay there. I think that's probably the best way, is just staying in shape. And then next to that too, depending on how your body responds to testosterone is the frequency of the injections. I've seen patients' estradiol ranges come down significantly just by starting to split up their injections more frequently because they don't get that spike in aromatase. If they're doing, one shot a week, which we never really recommend, we try to go at 2 for most patients if they're on TRT. And when I say TRT, anywhere from 120 milligrams to 250 is like a typical TRT dosage that you would normally see. So twice a week on that. And then, if they're having severe estradiol issues, we'll try to see if they're cool with doing like more microdosing, like administrations. So 3, 4 every day, if they can be okay with it, and do like small little shots with an insulin needle. But that's another way to decrease it for some patients.
Outside of that kind of like clinical recommendation, because we do have to remember that in a clinic setting, you do have to make recommendations based more on what the majority of patients will want to do. Sometimes it's a little bit less optimal. That's why a lot of medications are produced how they are, because the companies have to look at it from a general public point of view as opposed to what might be, the exact precise way to do it. So ignoring that, in your opinion, what is the optimal frequency of injections for both HRT and if you're cranking things up a little bit?
In my opinion, if you're on a true TRT dosage, if you're not, going too far past superphysiological doses, I think 2 or 3 times a week is acceptable. I think, and again, I say this prefacing for most patients, I think as that dosage increases, you really need to think about splitting that dosage up. So if I'm taking, 500 milligrams of testosterone, which is obviously far past super physiological dosages, I'm going no less than every other day on my injections. For me personally, I try to split them every day if I can. It's kind of a pain even for me, but every day with higher dosages is definitely the best form of administration. There's no that's going to be the best, most optimal way to do it.
Because those peaks and valleys from doing it the other way are going to really wreak havoc on your entire system, right?
Right, exactly. And I think and I could just be on bro science on this, but as those dosages increase, I feel like your body can only handle so much of a drug at once. So I think doing it in smaller dosages, I feel like your body's able to uptake it better. That's my opinion with it. Again, I mean, I've used higher dosages with using like less frequent injections, and I don't feel as good. So that's why I think the more frequent dosages and the more frequent injections with the higher dosages make more sense. But then even going back to, like, if we're going back to HRT, like, you're right. Like, originally HRT is supposed to be done like once a week, just because most patients aren't going to adhere to doing more than one injection a week, let alone like they're probably going to forget their one injection a week, if we're just talking about normal people. So
that's always the disconnect too. Yeah. That's the craziest part, because it's like we have to keep in mind that there's some people where this stuff is totally foreign to. And I'll tell clients all the time, like, I would inject my toothpaste if it worked better somehow. So I don't give a shit. But it's, different strokes for different folks. So it's going to play in completely differently. Now, with frequency of injection being optimal at that 2 to 3 days per week, do you feel that you're going to see different issues if you're using a different ester? Do the esters really matter? Or are we looking into just, no matter what you're doing, short esters, long esters, no esters? Not that that's being prescribed in a clinical setting as far as no esters, but how frequently do we do it then?
So in a typical medical setting, cypionate tends to be the most common form of ester in the medical world. I don't exactly know why. That's just most compounding pharmacies just prefer to do cypionate. It might be a cost issue. You see an enthate here and there. And some compounding pharmacies will compound everything. I mean, they can do blends, they can do short esters like propionate, things like that. So you usually see cypionate, an enthate, and propionate available in the medical world from compounding pharmacies. If you're using a cypionate or an enthate, I mean, 2 to 3 times a week is going to be pretty optimal. They're almost the same. I mean, carbon chain wise, I believe cypionate and an enthate are only like 1 carbon chain difference. They're 8 and 7. So, I mean, you're talking a day or 2 half-life difference. If you're getting into propionate, you probably want to do it at least every other day or every day. Again, we don't prescribe propionate very often because most patients would never adhere to it. And typically, I mean, just anecdotally, we usually see that propionate hurts a little bit more, the post-injection pain.
So regardless of what ester you're choosing, are you always going to look for that the more frequent, the better type approach?
That's what I was getting to, yeah. So I think personally, if you're doing a cypionate or an enthate, or even a decanate, it doesn't matter the ester. If you're doing that ester every single day, eventually you're going to reach a peak serum concentration. It's just going to stay there. If you do your cypionate every single day, or you do your propionate every single day, from a medical or a bodybuilding perspective, I don't think it matters. I think it just matters that you do that form of medication every single day, and it's going to come out to the same peak blood concentration. You do have to take into account ester weight. So, if you're doing propionate, you're going to get more of the drug than if you're doing cypionate, if you're doing the same dosage, especially in TRT, because we're using smaller dosages. So, 200 milligrams of test prop, maybe that's what? I think it's 90%. And then I think cypionate is about 70%. So, that's like 20-ish milligrams per week, which is pretty significant in HRT doses. So that's the only thing you'd have to consider. But I think frequency-wise, if you're using a short ester or a long ester, you're going to come out with the same result.
Let's zero in on that for a second, because that's something that I find to be incredibly overlooked. So just straightforward, is 200 milligrams of test propionate stronger than 200 milligrams of test cypionate?
Technically, yeah. If you're considering ester weight, and I'm trying to go off my memory. I believe propionate, if for every 100 milligrams of test propionate you inject, your body utilizes about 90% of it due to the ester weight. And then if you do that to cypionate, it's like 69 or 70 milligrams, if I remember correctly, of every 100 milligrams. So if you're doing 200 milligrams, it's almost a 40 milligram difference. It could be, for HRT, it could be pretty significant. For bodybuilders, it really doesn't mean shit. It's such a small, insignificant amount. But if you are talking TRT dosages, then yes, it could make a pretty significant difference in the patient.
Now, do you agree that injections in general are going to be your better route of administration? Because in the anti-aging community, there's all this talk about the transscrotal cream, which is basically putting test deodorant on your ball sack, and then there's the pellet procedures, which I've heard nothing but bad things about, but I might be wrong. And then there's like troches, like the sublinguals under the tongue. There's even pills now. But do you think any of these alternative administration routes are really worth anything? And do they have any application in bodybuilding?
Yeah, so definitely just starting off with zero application in bodybuilding. They're never going to get levels up high enough to where it's going to make a significant difference in muscle building. I think some of those forms of administration are great for women. I think the creams can be good for women because a lot of women do not like to do the injections. I think the pellet can be very good for women too. And I'm talking just normal women. I mean, if you're in the bodybuilding world, you need to learn to inject yourself. That's the best way to do it. It's the most controlled way to do these medications for the application, and it is the most bioavailable. When you're talking about creams do okay. I've seen guys get their numbers up, decently high with creams. The pellets I don't like, even though they do work very well because they are. You do the small surgical site, and it does stay in the body, and then it slowly seeps in the bloodstream. The problem with pellets is if you get the dosage wrong, you're stuck with that pellet in there for the next couple months, and then you can't adjust anything. And then the issue is, if it's too low, you can't just go in there and throw in an injectable testosterone to try and get it up higher, because then you don't know how much the pellet is actually doing, and it's just a nightmare. And I've seen pellets with, actually, for women too, that have testosterone and estradiol in them, which is that's a complete nightmare too. I mean, you need to really have a way to be able to titrate these doses up and get to an optimal dosage that's good for that patient. And if you mess that up, there's no way to really go back. And then there's the oral form of testosterone, which to me is very gimmicky. There's different brands like Kaisertrex, and there's a couple different ones. I've seen clinics advertise them. So the thing with oral testosterone, you have to use oral testosterone undecanate. That is the most bioavailable form of an oral form of testosterone. And what they do, so to preface, oral testosterone has about a 3% bioavailability. Like, it is way, way down there. So what they do is they load you up on this. Like, they give you like 100 and something milligrams per day, and you take a shitload of this stuff every day so you can get just enough for it to work. So while it does work, if you take that much of it, I mean, just take enough to where you get the doses that you need of that, whatever, 3 or 4%. The problem is it's super expensive. So like, while it's working, you're getting the oral testosterone, it is working to get you to a normal HRT like level of testosterone. It's going to cost you like $400 or $500 a month. Whereas, I mean, you could do injectable testosterone through us for it's going to be like $80 a month, if that.
Now, does this oral testosterone administration, knowing that it will never build your levels up high enough to actually build any muscle in a bodybuilding setting, are there any actual applications for it for training, like a pre-workout dosage of it, or are you just kind of dropping a couple droplets of water into a giant bucket there?
Yeah, you said it best. I mean, it's just not, you're not going to get enough of it. It doesn't really seem to. For you to have to take so much of that, the cost efficiency doesn't make sense. And then I wonder, after a certain point, if that bioavailability even decreases, past that, considering how much you're taking. I mean, for a bodybuilding purpose, if you're trying to do something pre-workout, The tried and true methods are oral steroids and then anything with no ester. I mean, testosterone, no ester, things like that. If you're trying to just get something in your system as quickly as possible, that's going to be your best route.
Now, what orally administered AAS are available still for prescription in the clinical setting? Because about 5 or 6 years ago, I was prescribed farm-grade oxandrolone, Anavar, and at that point in time, it was the strongest shit I ever put in my body. It was insane. Are those things still available? Because the laws change all the time.
Mm-hmm. Currently, compounded Anavar is still available. There was this big thing that happened. I think it wasn't last year. I think it was about a year and a half ago. I think it was around June 2023. The FDA, there were certain brands of oxandrolone, of Anavar. There was one specifically that they had spoke about, which was Gemini Labs, and they make a commercial brand called Oxandrin. And that specific like pharmaceutical company and that specific brand was cited to have just adverse side effects that the FDA was like, we have to essentially call a meeting and see if this medication should be still available on the FDA approved list, and keep their patent. And they called the court date and they just didn't show up, which basically just means like, yeah, we don't want it. Like you can take it off the market, which makes sense because they probably don't sell that much, Anavar. How many people really get prescribed Anavar out of everyone in the United States? I mean, such a small percentage. So they're probably not making much money off of it. So they probably had no issue just stopping the making of it. And there were a couple other pharmaceutical brands too, I believe, that were also named on that. And basically just all those brands went away. But the generic compounding, so meaning not a commercially available brand, so a compounding pharmacy that orders the raw material and compounds it, sterilizes it, compounds it at their facility with no generic, it's just generic, doesn't have like a special brand or anything, it's just oxandrolone, that is available still. So those are they can compound them anywhere from like 2.5 milligrams up to 50 milligrams typically is the prescribed dosage. And they can prescribe them for men and women.
Now, with all these orals, both in a clinical setting, or maybe we even focus more outside the clinical setting, maybe we segue into bodybuilding or just athletics in general right now. We were talking about the availability and the percentage that you actually will metabolize and use. With orals, are you trying to build up to a base level like you are with injectables? Or are you applying it more of in a pre or post-workout setting? Because 100 different people seem to have 100 different opinions. What, in your opinion, is the best and most practical application of oral steroids in competitive bodybuilding or just performance enhancement in general?
So my opinion on this has changed. I used to believe you need to take the oral every single day and have it build up in your system and to get the full benefit of it. But me personally, I have severe GI issues using certain oral steroids. So when I say severe GI issues, I mean like bad acid reflux, just no appetite. I can't eat. My stomach feels bloated. Just all the things that you don't want, especially when you're trying to eat in an off season. So I've never really been a fan of like Anadrol, Anabol, things like that. In prep, with food being a little bit lower, I can usually handle it, but I still have that crazy like acid reflux. It's just awful. So I started experimenting where I would just do the Anavar, or whatever oral steroid I'm taking. If it's Anavar, sometimes I'll take Anadrol. I would only do that pre-workout, and then I would take it off. However many. If I'm training 5 days a week, I would take it off the other 2 days, and that worked really well for me. And I noticed the significant, the non-androgen receptor mediated, effects, like the neurological effects, like the strength increases, the better pumps, things like that. I felt good on it, and I didn't have as bad of GI issues. So because of that, my opinions definitely changed. I think you can take an oral steroid only a couple days a week and still get a great benefit out of it. I don't think you have to take it every day.
I 100% agree with you on that. And it's funny because I used to think the same way. So I came up, 2006, 7, 8, when I really started utilizing some stuff, working with guys like, Dave Palumbo and Fakhri Mubarak and those guys on that kind of original edge of coaching. And I'm not saying either of them or any of them told me to do any of these things specifically. I'm just saying that was kind of the mindset that I was initially brought up in. And it was the same thing. It was just saturate with the gear, build up the levels, and that's what's going to actually give you the benefit. Then you learn a little bit more about these, particularly these alkylated steroids that have to pass through your liver twice. And that first pass through the liver is where you're getting exactly what you just said, that neurological effect. And that's where the real magic, in my opinion, happens, because that's where all the little differences come into play. And that's how Anadrol is different than Anavar, which is different than D-ball, which is different than T-ball. And once you kind of relearn that, it kind of opens up this whole new world that's incredibly complicated. So that's a podcast in and of itself, but it's really cool to dive into. And then I feel like not having to do it every day and get that saturated dose, you're not dealing with nearly as many of the side effects, like the impact on your HDL, the impact on your liver, et cetera, et cetera. So without having to go into the deep details of each individual oral, let's do this. What orals do you think in a bodybuilding setting or a performance setting are incredibly underrated? And which ones do you think are incredibly overrated?
Underrated Anavar. I don't know why you hear guys all the time, it's a girl steroid, it's not strong. I mean, real Anavar, and I don't know if I've ever taken real Anavar up until last year because I never took any, prescription. Man, I don't, 25 milligrams. And I remember going up to, 100 of underground lab and, for what I thought was a reputable underground lab, and feeling something. I'm like, yeah, I'm taking something, but I don't know if it was actual Anavar. But man, 25 milligrams of prescribed Anavar. I take that, go into the gym. 30 pounds on my bench press. I'm like, I've never felt anything like that. So I think that's a very underrated steroid. And I think it makes a very big impact, especially when you're calorie depleted and you're in a calorie deficit. You're glycogen depleted, you're very low body fat. I think that's when those type of steroids really shine. And then I think I don't know if it's underrated, but Anadrol, man, same thing. The strength gains, the neurological strength, aggression, pump, like all of those effects, are just unbelievable in Anadrol. So that's one that I think everyone understands is good, but it's definitely good. Overrated, I think Dianabol is incredibly overrated. I think there's a lot of better steroids out there, in my opinion. I just never responded well to it. I don't know a lot of people that respond well to it. They just, I'm kind of, I don't really think everyone just gains like 20 pounds is just like, oh, it's all water. I just think they just don't really get much out of it in general. So I think that's one of the most overrated oral steroids. What else it's overrated? I think all of them are pretty damn good. I think Dianabol is the only one that you know what? You know which one I think is a little underrated is T-ball, Turinabol. I think
Agreed,
T-ball
100%.
is pretty really underrated. I think it can be used in an appropriate application can be very, very good. Not a lot of liver hepatotoxicity. I think it can be used in a prep. I think it can be used in an off season. I think it can be utilized very well if you do it correctly.
No, I agree with that so much. I'm so glad that you said that. So I always make a funny comparison between T-ball and things like injectable carnitine. And I know that sounds completely batshit crazy right off the rap, but I believe them both to be similar in the sense that they only work as hard as you do. So they're substances that will drive performance, but if you don't take advantage of that and drive your performance, you're not going to get the subsequent change physiologically that you would get from doing that. You can't just take it.
Yeah, and that's a good point too. It's funny. I heard Fawad Abiad talk about this in a podcast recently, where he was talking about like what he used to take back in the day, and he would take certain drugs just for the strength gains. Like it wouldn't be for building muscle. Like they had a purpose of just making his training better. So originally, his go-to drug for that was Anadrol. He'd take Anadrol off season. it drive the strength gains, and then that would allow him to build muscle. And then he would use things like testosterone to help facilitate that growth, and then obviously food and everything else. But the Anadrol was just there for that one purpose. But then as he got older, had so much GI issues with the Anadrol that he's like, man, I can't take this anymore. I need to take something else. So he started taking Trenbolone, which makes perfect sense. If that doesn't cause any type of GI distress or anything that's going to make your off season worse, and you're just using it at a low dose just to make your training a little bit better, to focus, to be stronger, to be more aggressive in the gym, things like that, and you're just using it for that, it kind of makes sense. I think we lose sight of that. We just think like, oh, we're taking this drug so we can get like harder, or we're taking this drug just so we can build muscle. But we forget like these drugs they're performance enhancing drugs. We can use them for performance enhancement. They're not just there just to build muscle.
Right. And I think a lot of this gets lost because coaching is a potentially very lucrative industry. We both know that. And in some cases, you can kind of get in on it and start making a lot of money kind of despite yourself. So I find that that's kind of what the main cause is of misinformation running rampant. It's because a lot of coaches are just finding success because maybe they have a knack for something. I always compare it to like the mechanic that can fix your car every time but has no idea what any of the parts are called. That'll work to an extent, but you're really kind of like missing out on potential benefits and potential applications by not realizing how these things actually work, by just looking at it as this is a hardener, or this is an off-season drug, or this is a pre-contest drug, because there's really nothing like that exists. No pharmaceutical company ever made a drug for pre-contest. That's not a thing. These drugs are made to do specific things and have specific actions, and you can kind of manipulate how you take them to put that action in place to use it towards your benefit. And that's where having a background like you do, where you're getting into the medical side of things, becomes so important as a coach. Now, I'm not saying every coach needs to open an HRT clinic. That'd be cool, but that's not that feasible. Yeah. But digging into how these things are actually produced and why they're produced, and knowing the actual clinical application, not just bodybuilders take it for this reason, is crucial. And I feel like that should be common sense, but it's really not, because I feel like 8 out of 10 coaches are just kind of going on this, what I call YouTube education. Now, backtracking a little bit, because you did say something very interesting that caught my attention, because it is very true. And that's that people refer to Anavar as a girl steroid because, it's weaker and it doesn't have as strong a masculinizing effect potentially, despite it being a DHT. So even that logic is a little bit flawed on behalf of people that say it. Now, we're talking about dosages, and we're talking about how like that 25 milligrams of real Anavar, that took you, a high-level competitive bodybuilder, to another level in performance and body composition. Yet you see a lot of plans out there, and these girls are taking 25 milligrams, 50 milligrams, 75 milligrams of Anavar, and they're taking it for like 8, 10, 12, 16, 20 weeks. And then we're kind of scratching our heads like we don't realize why there are side effects coming on. What type of doses should women be looking at kind of generalistically as far as anabolics go? Because I think a lot of people are pushing them way too hard.
I think so too. I mean, personally for me, I like to experiment, but I also know when there's certain thresholds for certain drugs. And if you're first starting in the anabolic world, you want to use the least amount possible. There's no benefit to you taking an absorbent amount of steroids right out the gate. All you're going to do is you're going to reach a ceiling faster, and then you're not going to be able to press past that ceiling because you're using so many drugs that you're not going to be able to handle all the oil, you're going to have health effects, or you're not going to be able to afford it. I mean, you're getting to the point where it just becomes ridiculous, and then you can't get any bigger. You have to learn to leverage other things. So I think to answer your first question, women starting with Anavar, in my opinion, if it's real Anavar, I mean, you could probably get away with like 2.5 to 5 milligrams to start. And that's a start, I mean, we're not looking to just blast you with drugs. And there may be a time and a place for that too. I mean, if you're going to get your pro card, if you're going to the Olympia, maybe you experiment with some things and you go, all right, let's blow the wheels off this thing. Let's see what we can do with this. And, whether it helps or not, the placebo enough will get you to train harder. But I think when you're first stepping into the world of anabolics, less is more. Learn your body. Don't add more than one drug at a time, because then you don't know what's doing what, whether it's good or bad. That's not good. If you got two drugs that are in there that are both doing good things, you don't know which one's actually, like, which one's better. You maybe only needed one. And then if you throw in two different drugs you're taking and you're having side effects, now you don't know which one's causing the side effect. So I think, yeah, just dabbing your foot in, and that's probably something I would have changed when I was younger. Back in my day, only 10 years ago, when I first started taking gear, the normal, you start at 500 milligrams. That was every steroid form was like 500 milligrams testosterone, start there. I probably would have started at 300. See how that works. Do it for 12 weeks, 4 months, 3 or 4 months, somewhere in there, see how it works. And then you can slowly titrate up. So I think less is more when you're first starting, and then you learn your body, and then you can start, figuring out where you want to go from there.
Now, if you're building your course, and let's just say it's somebody that has a little bit more experience, and we can kind of lean into like men as the example, but this could technically be men or women. Let's say somebody is in a scenario where they're blasting and cruising, and let's say they have maybe a couple shows under their belt. We'll call them just generally intermediate. That way it'll apply to competition and even non-competitive settings where people just want to maximize their potential. How long do you determine your actual blast to be? Like, when do you know when to blast? When do you know when to cruise? When do you know to titrate up? How do I actually build a course of anabolics?
So I'll talk about me specifically, because I think everyone is very individual when it comes to these things. I think the first thing that should always be thought of is your health. Because if you don't have your health, you're not going to be a bodybuilder. You're either dead or you're severely hindering yourself to be able to make progress. So that first and foremost, and I hate to, beat a dead horse, but that's the most important thing. I know everybody says it. Second thing, I think you should then consider what is your goal? Are you trying to turn pro next year? Are you trying to win a local level show? Are you just trying to put on 20 pounds? What is your goal? And then from there, you can kind of assess what your risk tolerance is. Do I blast for this entire year because I have 3 shows coming up? Maybe that's worth it to me. Maybe there's a big paycheck there. I got a big sponsor. I'm already a professional bodybuilder. I could go to the Olympia. It's worth it, But then let's say they're on the other side, like maybe it's my 3rd year competing. I haven't won an overall at a local show yet, but I want to hit 2 shows. Maybe your risk tolerance is just, I think maybe 6 months, blast for a good period of time, cruise for a little bit, and then, do your show, whatever you got to do. You might not want to go that heavy for that long. And then same thing with dosing. I mean, when you're doing your dosing, is it life or death for you to really try to look your best at the show, to put on that extra little bit of muscle? Is it really necessary, So it's kind of hard to say because everyone's different. And then going back, I'll use me as an example. I'm genetically pretty well disposed to not having very many side effects. And that also includes no negative health effects from steroids. I mean, I've been blasting and cruising for God knows how long, barely come off. I just did a regular ultrasound on my heart, pretty much almost all my organs, and everything came out completely fine. There's no cardiac remodeling. There's no plaque buildup. Liver and kidneys all look great. The guy who was doing the ultrasound was laughing because he's like, "Oh, you got $80,000 kidneys," because I have no kidney damage, no scarring, So things like that. I mean, I think that's something you also have to take into consideration is how well do you tolerate these drugs. But I push drugs. Blasting drugs would be for me probably from March of last year all the way until January of this year. So pretty considerable time frame, about 10 months. And I'm on a cruise, so 200 milligrams for the next 2 or 3 months. I'll just see how I feel. Not for any like specific health reasons. But for me, I always think like if you if you leave your gear dosage at a certain amount for too long a period of time, that then becomes your new like floor. And then you have to go up and up and up and up. So I think there is a benefit to, I think coming off, there's too many negatives to that. How mental health wise, physical wise, and I just think it holds you back. But I do think there is a purpose to cruising. Again, whether it's for health or whether it's just to give your body a little bit of a break, even like a mental health break. I mean, for me, work is very, very hectic. I think it's kind of nice to where I can just, take a step back. I don't have to train, as heavy, as hard. I'm still training, but just not really worried about it. Hitting my protein, goals, but not like super strict on my diet. And then, not having to pin all the time. It's kind of nice.
I agree 100% on that. Now, in building that blast, even for a prolonged blast, like the way that you're doing it. So let's say, you're finishing up this cruise that you're on, you do a couple rounds of blood work. Let's say you get another round of organ scans, not that you need to do those all the time, even though they're important to do. Everything checks out, clean calcium score, clean blood work, good to go, ready to start pushing things. Now, factoring out the fact that you've been doing this for a while, this ain't your first rodeo, you know specifically what drugs that you personally respond to. How do you go about building this, and do you titrate up? How long do you take to bump the drug doses up? When do you bump them up? And how do you go about choosing, am I picking just increased testosterone? Am I choosing a 19-nor like a nandrolone, an NPP, a trenbolone? Am I going the DHT route like Masteron Primo? Like, why would I go different directions? What are the benefits and the detriments of them? And how do I pick what the hell to do?
Yeah. So me personally, when I go, so I'm planning on probably going to do the Amateur Olympia in October. So I'll start my prep in April-ish, my pre-prep. So when I go back to my heavier doses, I'll probably go to 750 tests just off the bat. That's a pretty moderate dosage for me. I can get pretty high from there. 750 test, I'll probably run that for like 2 months, and then I'll probably bump the testosterone a little bit from there, maybe to like 1,000, 1,250, somewhere in there. Which again, for some people that is very high, but for me, that's, pretty like normal baseline testosterone. And then from there, me personally, I like to use the pre-contest drugs at lower dosages for longer periods of time. I feel like it gives your body time to develop into the look that you need, because I do believe that the pre-contest drugs, and by pre-contest drugs, I'm talking like Trenbolone, Masteron, Winstrol, drugs like that. Those give a certain look when you're lean enough. So that's when I'll typically put in like Trenbolone, Masteron, at a, probably a load like 25 to 50 milligrams every other day. And then I'll slowly titrate that up. And then from there, once prep starts, prep for me usually starts at 4 months out. I usually go week by week how I feel. If I feel like I'm starting to drag during my training sessions, that is when I will typically start to increase the dosages. I typically will put in orals around 8 to 10 weeks out, because again, I believe they need time to work. And same thing at lower dosages, 25 milligrams, and then add on to that. So I'll probably start off with like Anavar, 25 milligrams. Maybe 2 or 3 weeks later, I'll add in Winstrol, 25 milligrams. I also like to add in things one at a time, typically. Trying to Masteron's the exception to that usually, but I usually like to do things, one at a time, because I like to see how they're working. I am very aware that like as we get older, sometimes your response to different drugs is different. And then fat burners, same thing. Like I typically will put in fat burners when my cardio and my food my cardio gets too high or my food gets too low. So they're just another lever to pull, if that makes sense. So prep is usually done week by week and by how I feel. Off seasons, it kind of just depends. I feel like every off season is a little bit different. I'm usually seeing how much, like, once I get to a certain point and I go, okay, my food is really high, I'm not really gaining much weight, I'm not really getting much stronger in the gym, I think it's time we add something in. That's usually when I start to add things in. But I always I like a baseline. I've done this for a long time. The baseline of about 1,000 milligrams of testosterone, somewhere in there, 750 to like 1,000, 1,250. That feels pretty good. That's my go-to for most. And then I just bring all the other drugs around it.
Now, how consistently is growth hormone in there, if at all? And are you leaning more towards low-dose therapeutic, or are you pushing the limits on that one? Because there are people that will go either way with that, and it's pretty commonly debated.
Yeah, so I'm talking so much about steroids, I forgot about that. Growth hormone is huge for me. I think that's really important. I always use lower dosages, like 4 to like 6 IU. And I mean, I felt like it did something, but like it didn't really make that big of a difference, I felt like. And I was always like, growth hormone's kind of overrated. Once I started, and this only happened in the last like year and a half, I started pushing the doses at 10 IU plus. That's when I felt like it really made a difference.
What did you see when you bumped it up?
Just a certain look to my body. And I even put like progress photos like next to each other before, like when I was starting my prep to like after my prep, and like being around the same weight, and I just look fuller, I look rounder, I looked harder. Like my body just took on a different look, I felt like. Obviously no difference in strength gains or anything like that. But I just started to look freakier, I guess you could say. And I really do believe growth hormone has, and I don't know how well studied this is in humans, but that hyperplasia effect, when you really start to push that dosage up, I think really starts to shine. And I think that's why bodybuilders have gotten significantly bigger in the last like 20, 30 years.
Now, did you feel better when you were doing that, or did you start to feel like lethargic and run down? Because I've heard both.
That's kind of the problem. So when the dosage goes up, I definitely noticed I would just feel like sleeping all day. So like right now, for example, and I didn't lower it because I think like my dosage was too high on growth hormone. I just don't like fucking feeling lethargic and sleeping all day. So I lowered my dosage back down to 5 IU, and I just do it all in the morning or all at night, whenever I remember. And I feel way better on that. Just overall like well-being feeling. But I do believe there are times where you need to push the growth hormone in order to kind of set. I always use this example, like if your body is a canvas and you're painting, I believe the performance enhancing drugs, your nutrition, your training, that's, you're painting on the canvas, you're building it. I think the growth hormone is making the canvas bigger so you have more to paint on. That's how I feel growth hormone works. It's making the canvas bigger. It's creating new cells. And then everything else you're doing, the food, the training, and the other performance enhancing drugs are then utilizing that bigger canvas.
Are there any side effects you need to look out for when you're cranking growth hormone up really high, or is it just something that's generally pretty safe?
Generally safe. I mean, I will say like you notice. I mean, I notice things like my hands get very like swollen from the water retention. I don't. They don't really hurt. I know sometimes that water can press on the nerves in your hands, so I don't usually have that. That type of like pain in my hands or anything like that. The one thing you really want to watch out for that's actually like a health marker risk is the increased glucose, because growth hormone does liberate fatty acids and glucose in the bloodstream. So you want to make sure your blood glucose levels aren't raising too high, which a lot of people can mitigate just by taking it at night. So, I mean, and then you get the benefits of the sleep and everything too. But I've never had that issue. I always take my fasted blood glucose, and it's usually 80, somewhere in there. It's nothing, crazy. And that's not really that bad considering the amount of calories I'm eating. And then blood pressure too. So if you're getting that increased water retention, check your blood pressure, make sure that's not getting too high. But other than that, I mean, I know a lot of people, worry about like the cancer risk too. If you have a current, cancer that's building, tumor, whatever it is, that can accelerate it. But you probably shouldn't be taking growth hormone in the first place if you're prone to any type of risk for cancer, I would say.
I never actually saw any studies that directly say that that's going to happen. It's theoretical, not saying everybody should just haphazardly do it, but I think that fear is a little overstated. But I agree. I think there's a lot to be examined with higher doses of growth hormone. 2, 3, 4 IUs a day. I mean, people look at that like that's some sort of monstrous amount. These are barely creeping over replacement doses. Not to say they're not beneficial, but I do think there's a certain magic when you cross beyond 6, 7, 8. Again, not saying everybody should go do that, but let's put it this way. I've never really noticed that much from sub 6. And then once you go above that, that's where I start to notice like, oh, wow, I'm taking something. Something's really happening here. Yeah. So I agree with that 1,000% as well. Are there any other peptides that you have in the mix, or are you sticking basically to anabolics and growth for your particular courses?
Those are mainly what I take. I mean, I'll throw in BPC and TB500 every now and then just for little nagging injuries. I do take... every morning, just for gut health, I like to do the oral BPC and a KPV mix from our pharmacy. I feel like it works well. I don't know if that's like, I know the bioavailability of those is kind of like in a mixed bag. Some, it's not the best, but I think it does work, pretty well. And then I'll use the injectable if I have any type of like, nagging injuries or anything like that. And what else do I take? I do like a drug called, I don't know if you've ever heard of it, called Megastrol.
It sounds familiar. Is that the appetite one?
That's the appetite one. Yeah, it's a progestin. They usually prescribe it for, muscle wasting diseases, cancer, HIV, things like that. I really like that during my off season. Drugs like MK, GHRP, things like that. I get the initial boost, but then it kind of tapers off really quickly. Megastrol is an interesting one for me because I feel like I'm not necessarily like hungrier, like I want to eat, but once I start eating, it's like I don't get full. Like I can just keep eating. It's very strange. But that's a drug that I've had in my concoction every off season. I'll usually do that for a couple months, during my like bigger push phases when my calories get pretty high.
Now, that one is one that I would consider super underrated because it's kind of hard for me at this point, and I hate to admit this, but it's hard for me to find a drug I haven't at least tried. And that's one that I know I haven't tried, and I haven't heard a whole lot of people talk about. Have you been using that? Have you been utilizing that with your clients, and are you seeing this as like kind of like a hidden gem for people to put size on?
Yeah, I'll use it for more advanced clients. I mean, it's not something I'll just get. I mean, if you can't eat 3,000 calories a day, I don't know what to tell you. But, if someone's going, 5,000, 6,000 calories a day or higher, I've had one client eat even more than that, which is I don't know how he does it. But for those really high, like guys that like big dudes that need to eat a lot, I think it can be very well utilized for sure.
Now, is that available as a prescription? Do you have to kind of get that where you get your other stuff? Like, where does somebody find this?
It's not a controlled substance, so you can find it pretty easily online, but we can't prescribe it to you. Like if we, like us here, like the most compounding pharmacies won't even know where to get it. But it isn't like a controlled substance. So think of it as like, how you can get you can order T3 online, you can order clenbuterol, things like that. Like a lot of those, like T3, T4, for example, is a prescribable medication, but because it's not a controlled substance, people can just go online and just put for research purposes only and say not for human consumption, and they can sell it, without getting in trouble. Same thing, Arimidex, Aromacin, all those different ancillaries. Like we can prescribe those to you, but you can also just go online and get them on research chemical laboratory sites.
So not something that's hard to find if you're resourceful enough. And if you're not resourceful enough, you probably shouldn't be doing it.
Exactly. If you can't navigate the internet, I don't know what to tell you.
Gotcha. Well, Jasen, this has been awesome, man. And thank you so much for giving us a little bit of that personal insight to your prep. I would love to check back in with you kind of as this prep starts moving forward. Maybe we kind of document here and there, like what you're doing leading to this show. You said Amateur Olympia is what you're shooting for?
Yeah. And normally I like to do like USA's is the national show that I normally like to do, but it's kind of like in a weird spot where it's too close. And then the Amateur Olympia is here in Vegas. So it just saves me some money. I hate spending thousands of dollars to travel to a show when I can just do one in my backyard.
Right. And I think it'd be really cool for everybody, even if we don't convene back here regularly, which I would like to do, but to follow your journey around, because watching somebody that has access and insight into all these ways to do everything the right way, from getting the pharmaceuticals to getting the non-pharmaceuticals to taking care of blood work to getting these organ scans, I'm super intrigued by how somebody that knows how to mitigate damage and has access to the abilities to do so is going to build a prep for a fairly big motherfucking show. So that would be really cool. So I urge everybody to watch along with that one. Now, in the meantime, let's say, you know, I'm a bodybuilder, I'm a gym goer, I'm somebody that wants to look into HRT. Maybe I'm on HRT, but I'm not happy with the knowledge level of my provider. How do we get a hold of you? How do we get a hold of Helix HRT? What's the process like to become a patient?
It's really easy. The best way to get a hold of us is just go to helixhrt.com. And all you do is on there is a contact me form. So you just fill that out, and it'll just ask for your name, your phone number, your email, just basic contact information. You'll fill that out, and then you'll get an automated text message with the next steps. So it'll ask you if you're a patient, you just say no, and it'll give you some more information. We even have a video that goes over like the process of it. So depending on what you're looking for, if you're looking to possibly get prescribed testosterone, Anavar, if you want peptides, if you want Cialis, if you just want blood work, you don't have to talk to a doctor. You just get blood work and just get blood work through us, and that's completely fine. You don't have to get any medications. Like, we're pretty well-rounded in what we can, you know, the type of services we can give. So that's the best way to get a hold of us. Just go on the website, fill out that contact us form, and then you'll get automated text to lead you the way.
And this is just another example of why I never want to hear anybody, whether you're my client, you're not my client, you're just somebody that watches this, or you're just somebody in the fitness industry. I never want to hear anybody say, I don't know where to get blood work, because these places exist. There's a perfect example right there. So even if you're not looking into HRT, there's a company that can run your blood work and at least let you know where you're at. And then maybe it turns out that you need HRT. So there needs to be more clinics like this out there. And I really hope that one day this is commonplace, but also selfishly, I hope that you guys are the only show in town, and I hope you guys just kill it doing it on your own. But either way, there's that resource available for people. I'll link to all of those in the description. So if anybody needs to look into HRT, needs to look into blood work, or just has some general questions, they can reach out. But Jasen, again, thank you so much for your time. And thank you for that kind of deep dive into how you do things, because not everybody likes to put their own stuff out there. So I urge everybody at home to kind of watch along with your journey and kind of root you on as you prep for this fairly massive show. But what's most important is that while you do it the right way, which I think is really cool. So thanks again, and hopefully, all the best. Hopefully we get you back on here soon.